Hello, my name is Dr. Rafi Romano. Today I want to share with you Suresmile, which is to me one of the most amazing techniques and technology I've implemented in my clinic. I do think that it's a true revolution, and I hope that by the end of this lecture you will understand and agree with me why Suresmile is probably the future for your clinic. Today, the trend in orthodontics is to have customized treatment. We already understand that by buying a series of brackets from any manufacturer, regardless what the philosophy behind it and what a prescription was nicely implemented into these brackets, we cannot actually customize the treatment properly if we don't realize that every patient is different from each other. Today, there are many options that we can do in order to customize treatment. One of them is, of course, to use laboratory and do a proper setup for every patient, a laboratory or a virtual setup, and then place the brackets according to this setup in order to have a customized treatment. We can also use one of the CAD/CAM system like eBrace, Incognito, Harmony, or today Insignia by Omco, in order to have a customized molded bracket that is individually customized for any patient and for every patient, and then wires which are bended according to these brackets and according to these patients. These systems are very nice, but they create two major problems. One of them is, of course, price-wise, which we will discuss later, because in order to customize every bracket and mold every bracket to every patient, it raised the cost tremendously. And the second is, what happens if something is wrong and everything that you have planned does not go well? You have no flexibility, as we will discuss during this lecture, and this is one of the biggest advantages of the Suresmile technique. Regardless how innovative the CAD/CAM technique is, it is not comparable to the simple philosophy that we have today behind Suresmile. Suresmile is based, first of all, on scanning in the mouth, which today is a common thing in a dental clinic. Then everything is transferred into a computerized model with the braces, and then the doctor can slowly move the teeth up and down, left and right, consult with the technicians of Suresmile, get to the perfect occlusion that he dreams, then virtually send the information to a robot, one of probably the most amazing robots in dental field, that will produce for you wires to this specific case. Now we know that the only thing that moves the teeth is the wire. So therefore, it brings the control back to us. So let's see point by point. First of all, there is no more try and error. We can actually plan the movement of each wire. There is no need for expensive bracket system. As you will see, you can choose any bracket. You can keep working with a system that you like, or you can move to a very inexpensive bracket system. There is no need to pay for mistakes, not financially and not professionally, because if you have done some mistake and you need now to scan the case again, which takes another 20 minutes, and get new wires, you are not punished like you do if you do Invisalign, if you do Incognito, or any other CAD/CAM pre-planned technique. You can simulate the treatment and modify it at the end. Many times we get to the point where we want to end the treatment and we want to level the gums now. We get some comments from our prosthodontist. We get some comments from the patients because they want an extra movement. We can have a modification of the movements in any certain point of the treatment that we want. We can choose between buccal and lingual. I don't know many systems or any system that can coordinate wires for a buccal braces or lingual braces together with the buccal braces, which is quite common for people who do lingual orthodontics. We can visualize the bone coverage on every tooth. Today, there is no sense anymore for a 2D diagnosis, taking a panoramic X-ray or a cephalometric X-ray, which are 2-dimension, and then guess what is the bone support for these teeth. Today, we can incorporate CBCT into the Suresmile and actually visualize the amount of bone that covers the tooth in every aspect, buccally or palatally. We have no miracle. We put our orthodontic knowledge to, and it can be expressed into the treatment. Now, Suresmile has few advantages that I want to discuss in this short lecture. Technique, planning, speed, accuracy, simulation, team approach, finishing, and I will end with pricing. Technique is not the essence of Suresmile. Technology is what is the point here. The technology of Suresmile enable you to use any technique. We are not dealing now with another bracket system or another CAD/CAM system. It's a system, it's a technology that enable you to work with your own technique. You can have any bracket, any type, buccally, lingually, or you can even combine between different brackets. If you have a bracket that you design, or you have a company in China, in Singapore, or anywhere in the world that you are in love with their system, you can take this bracket set, send it to Suresmile, they will scan it, they will name it even with your name, and then the next time that you will log into the Suresmile system, you will be able to use your Rafi Romano brackets. Why not to work with multiple systems? Why not to work inside a certain case in the front with some brackets that we like, in the back in a different bracket system, and then when you scan and you specify which brackets I'm working, then the system immediately knows the slot, knows how to bend the wire to fit it. Now, planning. Planning is a very, very sophisticated yet fun thing with Suresmile. We have to do some learning curve in order to learn how to work with the Suresmile technique. It takes a little practice, like every new technique, how to work on a 3D model versus plaster model, or versus just looking in the mouse and guess what's gonna be. We are actually taking the teeth on the virtual model, move them, view what happened to the occlusion, view what happened to the bone, and eventually, when you get to the treatment itself, to the patient, you get a good result, good predictable results. Suresmile enable you to scan in the mouse, scan the plaster model if you want, gather all the records that we are used to gather, like photos, x-rays, CBCT when we need, and then you can take whatever you want. You can even export this data and have your silicone model, if you still likes to hold plaster or any physical model in your hand. We can do a planning which is totally virtually. On this case, before even putting one bracket, We choose a bracket out of the library in Suresmile. We place it on the teeth virtually, deciding where it's going to be on the teeth. Then we are actually planning the in and out, up and down, right and left on every tooth, still everything virtually. Then we do the before and after. We can even view how the wire is going to look. We can change the position of the bracket if we want to have less bends in the wire. We can add the gingiva, look at the level of the gingiva, plan aesthetic results as we want, then export it into STL file that go to a laboratory. The STL file is then poured into a model, and as you can see, the model here includes the virtual brackets that we have designed in the computer, chosen from a brand, a company that I like to work with. Then with a transfer tray on this model with the virtual bracket, I actually place the bracket in the mouth in the designed place where I wanted them to be. So you can see here the initial bonding, then you can see the scanning process. You can see remnants of this powder that we use in order to scan for the Suresmile technique. You can see here the case that was transformed from the scanning into a virtual model that now is not, it's a working model because this is already bonded in the mouth. And as you can see here, the case is aligned and finished in no time. And in this specific example, we have leveled the roots, as you can see here, in around 5 months, which is probably one of the toughest thing to do, especially with lingual appliance, where the interbracket distance is so small, very difficult to do this upright. And the Suresmile technique succeeded to do it in no time because of the precision of the planning and the wire bendings. Speed. Speed is probably one of the things today that companies publish. We do things fast. We do things very fast. And this is why they think that they can sell their system better than others. So I think that the reason my cases with Suresmile are faster is because I don't have anymore the back and forth. I don't have the try and error, which is so common in orthodontics. One of the reasons for us to elongate, to extend the treatment time is because we realize that we have done some errors and we go back and we go forth and we go back. With Suresmile, I hardly have it. I move from one wire to another with a very pre-planned program and a very predictable and known result. I know exactly in every stage what I want to achieve, and if I haven't achieved it, I don't change to the next wire. As you can see here, this case arrived to my clinic because she needed some implant in the cuspid area, and we needed to upright the root of the lateral incisor and the premolar. As you can see in the x-ray here, there was lack of space, and the patient had only 4 months before she had to go to the army, and we needed to do this upright as soon as we can. So we did the planning in the Suresmile technique, doing the upright properly, manufacturing the wire, and as you can see, this case is nicely done with very easy and nice for the doctor, because I have planned everything on the computer and all I need now is just let it work as I planned with a very simple and very even fun way of work. In 4 months, you can see the upright that we had, and already the patient has implant inside. We want to have also accuracy. We want to make sure that everything goes exactly to the point where we want it. And as you can see here, this case is a very, very complex case, but what is very unique in this case, except of the over-eruption of the molar, the lack of space for implants, the malalignment, the aesthetic problem in the gingival area. The most important problem was that the patient is not in Israel. This patient lives in Romania, and I have to do some remote control treatment, which means that I have to make sure that everything is accurate, that every movement is planned exactly. I will not go with you on the details of all this case, but as you can see here, we did all the simulation over the computer. I did consultation with the prosthodontist, with the periodontist in Romania, with the implantologist to decide how much space we need. We went into the mouth and implemented not only the Suresmile wire, but also accessories that was planned because of biomechanical problem that you as orthodontists must be aware of them. We need more anchorage. We added mini implants. We need more stabilization. We added second molar into the system. You can see the amount of intrusion we got in the molar area. You can see the case during treatment. You can see here already open space for implants. There is already intrusion, alignment, and you can see here already the implants in the mouth. This case, which is probably one of the toughest I've done for adults in interdisciplinary decision, is a 1-year treatment. So again, speed because of accuracy, because no back and forth, and very, very precise. Everything that you planned actually happened. You can see already the patient with implants, temporary restoration, very nice aligned arch. Now, the next point, which is very important, is the simulation possibility. I can do here some contacts with my referring doctors, which in this case is an orthodontic surgeon, is periodontist, and all of them said on this case, which arrived to my clinic around 10 years ago, that she is an orthodontic surgery case. She has retruded chin, asymmetry, very, very short mandible, and open bite, as you can see here. I was sure that on that time that I have no other option. The patient disappeared, came to me 10 years later. The only thing she did is a nose operation, and still we have open bite, we have cross bite, we have retruded mandible, proclination of the lower incisors, and some uneven gingival height. Again, I was sure this case should go for orthodontic surgery, and any other option was not on the table. Then I've decided that I will use the Suresmile, which I have in my office, and I will do the simulation. I want to learn from the system what can be done, not what needs to be done, but more important, what can be done. And then I can get the decision. So here you can see the case 10 years ago when she was 16, today when she's 26. And here we did all the simulation with the Suresmile, doing extraction of premolars and see what kind of occlusion I can get. I was very happy. I even incorporated into the simulation the patient's face, the patient's smile, in order to visualize if this case is indeed something that we can do without doing a surgery. You can see here that you can even view the relation between the lips, the exposure of the incisors. You can decide if you want to have intrusion to get a better exposure and a more attractive smile line. Here you can see the patient. She's still in treatment. That's a very difficult case, but you can see already what we have achieved. Look at the alignment of the upper and lower arch, upper extraction, lower interproximal stripping, and you can see the smile that we got versus how we started. And today, if I didn't have this option of the simulation with the Suresmile, which combines the teeth, the face, the bone, I think that I could have made a lot of mistakes with this patient. Also to let her go to another doctor because she refused to do any surgery. Team approach. Team approach is one of the probably nicest advantage of Suresmile. I do it a lot with oral surgeons. In this case, I was not that successful to do it in non-surgery. This is, of course, an orthodontic surgery case. But the advantage of Suresmile is when you get incorporation of the teeth and the bone, the oral surgeon can plan with me where the cut will be, how we gonna shift, in this case, the maxilla, how much advancement, how much rotation. Everything is pre-planned, and when I align the teeth, again, with the help of the simulation of Suresmile, to the desired place in the surgery, and the surgeon takes all this data and do it step by step in the surgery itself, we get a result which is predictable, is very, very aesthetic, and of course very fast because everything is pre-planned. To get to the finishing is one of the toughest problems in orthodontics. All of us get a very nice start, but we don't get proper finish to our cases. The advantage of Suresmile is, for example, in this case, when we have decided to open space for implant at the area of the upper right lateral incisors, and we have planned nicely with Invisalign, opening all this space here, which was opened very nicely, very predictable. Everything is aligned nicely, but still the roots are not perfectly aligned. So what we do here is take the virtual model that we already have. We don't need to rescan. Then on the model, I do this upright, central incisors and the cuspid, in order to have a place for the implant by uprighting the roots. Now, when we do this upright, immediately the wire is bent. So now, after I did the upright in the computer, I can order new wires and to finish this movement in no time. So, and the last point, and probably not less important, is the price-wise. Today, many people speak about CAD/CAM as very nice option, but very expensive. So today, Suresmile provide any clinician stages. You can decide that you want to have a virtual model, like I did in this case, which needed some simulation, some visualization of what will happen if I will move the teeth and do stripping. And for such case, I paid only 35 euros. I want you to know that prices is, of course, a matter to change, and I don't want to decide for Suresmile on the prices, but this is an average of a virtual model which you can do with it simulation as you want, get a data of all the things that you have done on the computer, how it is perceived by all the numbers of torque, angulation, and everything. You can take the case into producing aligners, your own aligners, sure aligners. In this case, I've done a little movement of the central and lateral incisors. I moved it into a computerized model, which I exported, produced a silicone model, and then made my own aligners. And for that, I paid only around 250 euro. Or you can take a full case when you can order as many wires as you want. You can order them in percentages, in different metal, in different sizes, and pay between 600 to 1,000 euro, depends of buccal, lingual, or the complexity of the case, or of course on your contract with Suresmile. In conclusion, Suresmile for me is the combination, the perfect combination from human intelligence and from technology, one of the most advanced technology today in orthodontics, which can incorporate any technique but still the highest technology. So for me, this is a true revolution. I hope you will enjoy it as well. Thank you very much, and I love to see you in my other lectures and video in Dr. Rafi Romano YouTube channel.